This week I was working with a patient with chronic low back pain. We did Graston for the first time on the low back. So having years of soreness, stiffness, tightness, just reduced flexibility motion through that lumbar spine, this is the first day I got to really work the muscles. And we had this big histamine response. You can see where the muscle's starting to stand up, gets more whitish at the beginning, much like a bee sting, and then it'll begin to turn a little bit more red, and we could see some of the petechiae or bruising showing up. It also feels thickened when you go to touch it. The person can reach back and feel that, hey, these muscles just are a little bit different. And this happens whenever we have a big response to the soft tissue treatments. We're breaking down that scar tissue, we're sliding along the skin, trying to rip up as many of the adhesions as we can in that low back. We start from superficial and work deep with Graston. And what a patient feels is this immediate, oh my God, what is going on back there? And they can feel the difference post-treatment. They notice they start feeling a little bit more flexible. So a lot of times we'll go right into the exercises of building on a little bit more of that flexibility, that range of motion, and then starting to work some of the strength and endurance to build that back up. We can do everything from cross crawl to quadruped, then working to ball unstable exercises where we're either laying across the ball, doing a cross crawl, or we can start working sitting on the ball, building up some more of that core stabilization without having to run the back through a lot of flexion extension. All these are great exercises to do during the course of treatment, right after we break up some of that scar tissue and that muscle guarding, while we got the body thinking a little bit different, trying to reteach it to learn to move as it should instead of just how it has been doing it the last few years.